Hi everyone, I'm Dr. Christine Schaffner, and today I wanted to share a few tools on how to use Briotech HOCl. We've been getting a lot of questions about Briotech HOCl, so I thought I would do a video to share with you what we are sharing with patients at Sophia Health Institute. Again, as a disclaimer, this is not intended for medical advice, and please consult your medical provider to make sure this is the right recommendation for you. So Briotech HOCl is a hypochlorous solution, and hypochlorous is something our white blood cells naturally produce as an anti-infective strategy to fight viruses and bacteria and fungi in the body. We've been using Briotech HOCl for a few years now as a staple in our chronic illness protocols because of its mechanism of action. If you want to learn more about HOCl and how it works, I did a webinar with Jeff Williams that you can find on Sophia Educate, and he goes through the mechanisms of why HOCl is such a supportive tool. So again, HOCl has had studies that really show that it can fight viruses such as HPV, also a family of coronaviruses that shows promise that it can be effective to COVID-19, and also prions. So it's a very, very effective tool. So we are confident that this is one tool in our toolkit to be empowered and proactive during this time. So the Briotech comes in a topical skin spray and then as an SOS. So the topical skin spray is actually traditionally used. It's actually a wonderful wound. It's wonderful for wound healing, burns, lots of different skin conditions. But we're using it as an anti-infective where we can spray our hands in between patients, or if you have to go out in public, and then we are having people spray their face. And when you spray your face, you're getting the HOCl in the eyes, and in the nose and in the mouth. And this is where the virus can enter our body through the mucous membranes. And so this is helping to decrease route and potential transmission. And then the SOS we've been using throughout the years as a dental rinse. It's really good for having a healthy oral microbiome. We're having patients gargle throughout the day because when we're exposed to viruses, the viruses can hang out in the roof of our mouth and in the tonsils, and they can grow there. So we're having people use SOS as a gargle. So that is something that you can use as well. And then I have this Omron handheld nebulizer. Dr. Klinghart's also sharing this mister that you can get on Amazon as well. But you can put the HOCl, and I prefer the skin spray that you can put directly into this. If that's too strong, you can use the SOS. Don't dilute the isotonic solution on its own. It's best to be diluted with saline, which the SOS is already pre-made. So when you have a nebulizer, you basically make the medicine a vapor that you can inhale. And so this can be a great preventative as well as potentially a treatment option for any lung symptoms. So, so yeah, these are some tools and some tips to use Briotech HOCl. I think it should be really part of anyone's first aid kit at this unique time and in general. And I hope you find this helpful.